Understanding emotional abuse, definitions, effects, and recovery. Emotional abuse is a deeply harmful form of interpersonal violence that affects millions of individuals worldwide. Unlike physical abuse, emotional abuse targets the victim's psyche, manipulating emotions and undermining self-worth. Experts in psychology and trauma have extensively studied emotional abuse, shedding light on its dynamics, consequences, and paths to healing. Defining emotional abuse according to Dr. Patricia Evans, a renowned author and expert in interpersonal communication, emotional abuse is characterized by a systematic pattern of behavior aimed at undermining an individual's sense of self-worth and autonomy through verbal attacks, constant criticism, and manipulation tactics designed to control and intimidate the victim. Types and manifestations. Emotional abuse can manifest in various forms. 1. Verbal abuse includes name-calling, insults, and demeaning language that chips away at the victim's self-esteem. 2. Gaslighting, as explained by Dr. Robin Stern, author and researcher. Gaslighting involves manipulative tactics aimed at making the victim doubt their own perceptions, memories, and sanity. This can lead to confusion and self-doubt. 3. Isolation. The abuser may isolate the victim from friends, family, or support networks, creating dependence and further control, as noted by Dr. Leslie Vernick, a licensed clinical social worker specializing in relationships. 4. Control. Imposing strict rules, monitoring activities, and using threats to dictate the victim's behavior and choices, as discussed by various experts in domestic violence and trauma. These tactics are often subtle and insidious, making it difficult for the victim to recognize the abuse and seek help. Impact of emotional abuse. The psychological impact of emotional abuse can be devastating and long-lasting. According to Dr. Judith Herman, a psychiatrist specializing in trauma, emotional abuse undermines the victim's sense of safety, trust, and self-worth. This can result in anxiety, depression, PTSD, and profound emotional pain. Dr. Lisa Fontes, a psychologist and author, notes that emotional abuse can impair cognitive functioning and decision-making abilities. Victims may struggle with chronic stress, insomnia, and difficulty forming healthy relationships in the future. Recovery and healing. Recovering from emotional abuse requires recognition, validation, and support. Dr. Beverly Engel, a psychotherapist and expert in trauma recovery, emphasizes the importance of self-care, setting boundaries, and seeking professional help through therapy, support groups, and self-help resources. These steps are crucial in rebuilding self-esteem, processing trauma, and learning healthy relationship dynamics. Dr. Evan Stark, a sociologist and advocate for victims of domestic violence, argues for legal recognition of emotional abuse as a form of coercive control. He advocates for policies and interventions that protect victims and hold abusers accountable. Conclusion. Emotional abuse is a pervasive and damaging form of interpersonal violence that leaves invisible scars on its victims. By understanding its dynamics, effects, and pathways to recovery, society can better support survivors and prevent future instances of abuse. Through education, awareness, and advocacy, we can create a safer and more compassionate environment for all individuals affected by emotional abuse. In summary, emotional abuse is a complex issue that requires nuanced understanding and proactive intervention. By acknowledging its impact and supporting victims, we can work towards a society where emotional safety and dignity are upheld for all.